Hi, my name is Credell, and I just wanted to talk about lupus and pretty much raise awareness. So the credits still pretty much go to the St. Lucia Arthritis and Lupus Association. You don't necessarily have to have lupus, fibromyalgia, or arthritis to become a member. If you are aware of someone going through that situation, it would be best to be equipped with the knowledge so that you could show the support that they pretty much need. However, this comes with like a really cool bookmark. It says lupus fact sheet. Also test yourself for lupus. So basically we'll just go over the lupus fact sheet first, and then we'll do a quick test, and you'll know if you have any signs of lupus, and from there what you can actually do. So on the fact sheet it says that lupus is not infectious, rare, or cancerous. That's the first point. Now, lupus is a chronic autoimmune disease that causes inflammation of various parts of the body, especially the skin, joints, blood, and kidney. So an autoimmune disease is where your immune system automatically attacks itself. So you don't really have that support that you need, but in the case of lupus, again, it affects the skin, joints, blood, and kidney. Now, approximately 5 million people worldwide have a form of lupus. Now, you could just be that 1 in the million, and you just want to make sure that you are aware of the symptoms and how you could actually improve your lifestyle and pretty much the disease. So although the cause of lupus is unknown, scientists think that individuals are genetically predisposed to lupus, and environmental factors such as infections, certain drugs, ultraviolet light, and extreme stress plays a role in triggering lupus. So you want to ensure that your environment is to the best that it could be, so that you do not put yourself in any stressful situations, so you avoid stress as much as possible. If the boyfriend is giving too much trouble, feel free to walk out. You'll get another one. If the girlfriend, feel free. If the family is giving trouble, feel free to move out. If the job is not working out and it's just more stress than anything else, it makes no sense to kill yourself over it. Move on. You'll get another job. Health is more important. Now, it also says that 90% of people with lupus are women, and I just happen to be a woman, so that's something to take into consideration. And we're not excluding the men, because they're the remaining 10%, and you just might be the 10%, that 1 in the 10%. So again, these are things that we should take into consideration. Now, lupus is more prevalent in Afro-Caribbeans, Hispanics, African Americans, Asian, and Native Americans. So you can get tested, but before we do that, let's move on. Now, only 10% of people with lupus will have a close relative who already or may develop lupus. So this is why I mentioned that it's very important that you are aware of lupus, and also that in your being aware, you could provide the support that they need, because in these trying times they will need as much support as they can get. Now, lupus can be difficult to diagnose as the symptoms come and go and often mimic other illnesses. So if you look at people with fibromyalgia and you look at people with lupus, their symptoms are similar, and this was hard for them to actually get the diagnosis. And most of them actually say that before they were diagnosed with lupus, they were once diagnosed with fibromyalgia. So that's something else to think about. Know your body and understand the different changes and how it pretty much affects your daily routine. So although lupus ranges from mild to life-threatening, the majority of the cases can be controlled with proper treatment. So again, you just want to make sure that you are aware, so that you do not let the situation get worse and then try to find help. Instead, if you know that you have it, then you could treat it before it actually gets to it worse. So with early diagnosis and management, 80 to 90% of people with lupus can live relatively normal life. So we're now gonna jump to test yourself for lupus. So it actually has 11 questions. You don't have to answer the questions out loud. So if you're watching it with a friend, you don't have to answer it out loud. It's just something that you can answer mentally, but just take down the amount of questions that you could actually answer yes to. So the first question is, have you ever had achy, painful, or swollen joints for more than 3 months? Do your fingers and your toes become pale, numb, or uncomfortable in the cold? Now, do not say you were in Castries. Castries was hot. You moved to Dennery. Dennery now cold. So that's what that causing the discomfort. Let's be real. Now, the third question, have you had any sores in your mouth for more than 2 weeks? Now, you don't have to be ashamed if you have sores in your mouth. It could mean so many different things, but you just want to ensure that whatever you have is controlled, it's treated. Have you ever been told that you have a low blood count, anemia, low white cells count, or low platelet count? Have you? Have you ever have prominent redness or color change in the shape or a butterfly across the bridge of your nose and cheeks? Now, before I pretty much used to look at people like that with like almost like I didn't know what it was, and it was like to me it was like something like leprosy. So this is why it's important again that you are knowledgeable so that you don't judge anyone, and instead of making harsh comments that you could actually show the support. Okay, now the next question, that's number 6. Have you ever had any unexplained fever of over 100 degrees for more than a few days? So don't say you don't have a thermometer, so you don't know what your temperatures are. RJ Clark, MNC, SNS have thermometers. You could actually get them if you have children. I'm pretty sure that you would have someone, you would have one around the house. Look for it, test yourself. Have you ever had sensitivity to the sun where your skin breaks out after being in the sun and it's definitely not sunburn? Number 8, have you ever had chest pain and breathing difficulties for more than a few days? Again, be honest with yourself. Next question. Have you ever been told you have had protein in your urine? Especially when you're pregnant, they send you for a lot of urinal tests, and that's one of the things that they actually look for. So if you have been told that you have protein in your pee, whether it be while you were pregnant, after you were pregnant, whatever, just click yes. Now, it says, have you ever experienced persistent extreme fatigue and weakness for days or even weeks at a time, even after 6 or 8 hours of restful night sleep? Have you? Have you ever had a seizure or convulsion? So these are the 11 questions. If you need to pretty much go over those questions, what you could do is go back to the beginning of the questions and you could ask yourself these questions, answer genuinely, and if you can answer yes to 3 or more of these questions, you have to talk to your doctor about lupus. Remember that the early diagnosis and proper medical care can often keep lupus under control. So you don't want to wait for it to become out of control, for you to try to find a control, or for it to be life-threatening. The earlier that you know about it, the better. So again, who doesn't want to live a normal life? It's not just about you, but you are your neighbor's keeper. So if you are aware of someone, it's important that if you know of someone who has the disease, again, you want to just be there to show the support in the right way. You want to ensure that you are knowledgeable of lupus and how it could affect them and how it could be improved. So becoming a member, as I've mentioned, and it's $30 and you get tons of discount. So you also get a pretty cool booklet. You get one with, it just shows the members of the St. Lucia Arthritis and Lupus Association, and also it comes with the privileges / discounts for just being a member. So you have interesting month meeting with guest speakers every second Thursday at the Ministry of Education conference room, the 3rd floor, NIC building, waterfront. You get a 20% discount on specific tests from laboratory services, all of the branches. Yes. Now you get a 20% discount on recommended treatment from Purity Day Spa at Calabash Cove, that's in Marisville. You also get a stretch and flexibility class with Margaret Gordon at VG for $20 per 1 hour session. You get a 10% discount at the following pharmacies. So for your bougie people, you get Tap Your Hospital, sorry. You also get from me more affordable Massey, MNC, and RJ Clark. You also get a 10% discount at Bay Medical Center on bone density tests. For those of you who have bone issues, take advantage of this. And also you get a 10% discount at Horizon Medical Supplies, that's Bay Medical Center, a 10% discount on first visit to Eye Care St. Lucia at the St. Lucia Blind Welfare Association. So if you have any problems with the eyes and you just pretty much don't want to go because you don't want to pay so much money, take advantage of that 10% discount that you're actually going to get. And you also have a 10% discount at Global Clinical Laboratories and a 50% discount at Micro Lab. Let me tell you, that 50% came in handy. Anyways, they also have Tai Chi classes, but you have to call the St. Lucia Arthritis and Lupus Association to register, and it's $5 per session, which is not bad at all. So remember, you will need to produce an ID and a membership card to receive those benefits. I'm just pretty much excited because I just saved a whole lot of money, and I'm very also, it would be really nice if you showed some support to those around you, and if you could actually find out ways to prevent lupus, or if you already have the disease, ways to keep it under control. So they provide meetings, and they also provide an email address if you have any concerns, and a telephone number just in case you want to speak with somebody about the disease. And also, this is what your membership is. So it's the St. Lucia Lupus Arthritis and Lupus Association. It's Sanssouci opposite Lucilec. You'll see the big blue sign. The membership, again, it's $30, and it does not take long to sign up. Again, so if you don't want to do it for yourself, remember that you are your neighbor's keeper, and it would be really nice if you showed that support. So please share that video. It could pretty much help out someone. If you don't have it, share the video, encourage someone to share the video, because we just want to raise awareness, and we just want to make sure that the people that are around us are cared for and they have the right support that they need, and we do not just assume because we are not aware. So have yourself a great day. Again, like and share this video.